35 says the number of spinal nerves, that's going to be 31 pair, and the 31 pair are going to be peripheral nerves. So PNS, they're all peripheral nerves. If we're talking about, remember, these cranial nerves, it's only cranial nerve 1 and 2 that are going to be always central. My 31 pair of spinal nerves are going to again emanate out of the intervertebral foramen. 36, where does CN2 leave the orbit? If I was to take a look inside of this skull, I notice that if this is the bony orbit, and I took my pen and put it inside of here, I can see that there's a hole right here that the pen is going inside of right now. And if I flip it on the inside here, I can see where actually that opening is coming inside of the skull itself. So it says, where does the cranial nerve number 2 leave the orbit? And again, if you look inside of the orbit, you'll see that it's at the medial aspect of it. So since this is lateral and this is medial, I can see that it's really at the medial aspect of the orbit. So it's at the medial aspect. Thirty-seven, bone contains the crista galli. The crista galli is actually here. So if I look here, I notice that there's a bone that's pushing upwards here. If this is the frontal bone, this is actually going to be the ethmoid bone, and therefore this is actually the crista galli or cribriform plate. So the question asks, what bone contains the crista galli? And the answer is that's going to be the ethmoid bone. .38 says bone contains the hypophysis. Again, if I look at the cranial vault, I can kind of see that the cranial vault has got my sphenoid bone here, and I can see it here, so my 2 fingers are in the sphenoid bone. In the middle here is going to be my sella turcica, so right where my finger is inside of, or this pen inside of, is where my pituitary gland would sit. So therefore, number 38, the bone that contains the hypophysis or the pituitary gland is going to be the sphenoid bone. Number 39, 2 parts of an IVD. Well, an IVD stands for an intervertebral disc. So if you said, well, you know, here's a vertebra, here's my vertebral column, and I'm looking at a anterior view of it, and I know that I'm going to have discs running in between the individual vertebrae. So that is an IVD. That's an intervertebral disc. And if I took a look at that intervertebral disc, if I removed it from the vertebral column, I would see that it has 2 parts to it. It's going to have an inner part and an outer part. It's that inner part that's going to be called the nucleus pulposus, and the outer part called the annulus fibrosus. The significance of the nucleus pulposus, it has a high water content. So that's what shrinks with age and injury. So if someone was 6'4" when they were 18, by the time they're 40, they may be 6'1", and the reason being they've lost that water content of the nucleus pulposus, and of course that's why they probably have back pain. Number 40 says a type of joint formed by an IVD Well, an intervertebral disc, if you kind of think of what it's going to do, it's going to allow for some type of motion. And so if we just take and do very quickly run through the vertebral column, we know we've got C1 and C2, and then we go down all the way to C7, and C7 goes then to T1, and T1 goes all the way to T12. T12 goes to L1. L1 goes down to L5. L5 goes to S1. S1 goes down to S5. And S goes to coccygeal 1 to coccygeal 4. And so if we take a look at this now, we know that C1 is the atlas, C2 is the axis. Those are all vertebrae that have a joint between them. So therefore, the joint between the atlas and the axis is going to allow for a fully movable joint. So that's going to be diarthrotic. As I move from C2 all the way to C7, C7 all the way down to T12, T12 all the way to L5, those are going to be joints that are going to allow for very slim movement, and that's going to be called lateral flexion. So because it's just lateral flexion, they're going to be amphiarthrotic, or slightly movable. And then when I take to my S1 through S5, those are going to fuse into the sacrum, and the CO1 through CO4 are going to fuse into the coccyx. And therefore the sacrum is fused, so that's going to be a fused joint, so that's going to be synarthrotic. And this is going to be synarthrotic. So the question asks, what type of joint do you find? You find all three types of joints. You find the diarthrotic between C1, C2. You see amphiarthrotic through the majority of the vertebrae. And finally, with the fused sacrum and the fused coccyx, you're going to see synarthrotic or immovable joints because they fuse together. Number 41. 41 just is a question above. Above, we're going to use the word supra. Like if we were talking about a muscle of the rotator cuff, we could say it'd be supraspinatus, above the spine of the scapula. 42 says below, that's going to be infra. If we were talking about the rotator cuff again, we would say that the rotator cuff has the infraspinatus, or below the spine of the scapula. Number 43 says a mature bone cell, that's an osteocyte. Remember, an osteocyte can no longer divide, so therefore it's a mature cell, and therefore it's amitotic. Those are what my body uses to get more calcium. So when I get my osteoclasts, the osteoclasts break down my osteocytes, and then the osteocyte breakdown causes my serum calcium to go up. But the downside of that is when my serum calcium goes up from increased osteoclastic activity, I'm going to develop a decreased bone density, which is osteoporosis or osteopenia. And of course, that's what we're going to relate to, for example, a woman in menopause that has a decrease in estrogen. 44 is the little canals. Again, I drew an osteon, so now we're just going to add one more little piece here. If this is an osteon, and here's an osteon sitting alongside of it, And here's another osteon sitting alongside of it. There's little canals that are going to join that for a blood supply, and those are going to be called the canaliculi. Those are going to allow for the supply of nutrients and blood to the living bone. Number 45 says the flat lining cells. Well, liner covers epithelium. If it's a flat cell, it's going to be a squamous. So therefore, we're going to say it's a simple, which means one layer, squamous, which means flat epithelium, lines or covers. If we were in a blood supply, we would just change that word to an endothelium. And again, just always remember, if it was simple, it would be just a one-layered cell on a basement membrane. If it was stratified, it would be a basement membrane with layers on top of layers of cells. So simple versus stratified. 46, it says flat line, 40, I'm sorry, did I miss one there? That's 46 I did here, so excuse me. This is 46. Let me go back to 45. 45 says surrounds the heart. If I was to draw my heart very simply, I would say that here's my box heart. I know the heart has got a sac that surrounds it, and I know that this is therefore the lining of a chamber is going to be the endocardium. I know that's going to be a simple squamous epithelium. I know that the heart itself has got a epicardium, and the epicardium is going to be connective tissue. I'll just write it out, connective tissue. And then the heart's inside of a sac called the pericardium. And that's also going to be connective tissue. So therefore, when it says that it surrounds the heart, that's going to be the pericardium. So when you think of pericarditis, an inflammation of the pericardium, if someone had like cardiac tamponade for an accumulation of fluid inside of the pericardium, they would take a large needle and do a pericardiocentesis. So those are things you want to know the terminology whenever you talk about the heart or cardiology. Number 47 says cells that line the windpipe. Remember, the windpipe is commonly called the trachea. And of course, what cells line the trachea is that PSCCE. That's going to stand for pseudo, stratified, ciliated, columnar epithelium. Number 48. 48 says covers the epiphysis. Remember, the epiphysis is going to be the end of a long bone. Ends of long bones will be covered by hyaline, which means shiny, articular cartilage. 49. 49 says spongy bone. Spongy bone is also called cancellous bone. It's that cancellous bone that's going to be found inside the trabeculae, and therefore that's going to be found in those tubules. And if we're looking at a long bone, it's somewhere in that proximal epiphysis, distal diaphysis, or metaphysis area. 50 says rings in the Haversian system. The rings are going to be called the lamellae. Again, we're just really looking at the concentric rings of an osteon. 51 says the number of adult teeth, and that's 32. Remember, that's going to be permanent. And of course, that's a variable number. 52 says number of false ribs. A false rib is not going to directly attach to the sternum, so it's going to be called a vertebral chondrule. Chondra is cartilage, so it's going to attach to costal cartilage. It kind of piggybacks off of a true rib or a vertebral sternal rib. 53, another name for the false ribs. And of course we know that the number of false ribs, so if we just think of ribs, this really should be here, so this is really answering 53. 52 said the number of false ribs, and that's going to be 3 pair. So just remember, if you're talking about ribs, you're going to have 7 pair of true, you're going to have 3 pair of false, and you're going to have 2 pair of floating. The true ribs are going to attach directly to the vertebrae in the sternum. The false ribs are going to attach directly from the vertebrae to the costal cartilage, and the floating ribs are strictly going to be attached to the vertebrae. And of course, that attachment naturally is going to be in the posterior aspect. 54 says the number of true ribs. We already answered that. That's going to be 7 pair. And of course, that's going to be 14. Number 55 is the costa. Remember, costa is just another name for a rib. 56. Before we go to 56, let's just take a quick view of a rib. We've all eaten ribs. If you kind of think that this is a rib, and then there's another rib below it here, and therefore this is a costa, and this is a costa, and sitting between each rib is going to be called the intercostal space. That's going to be significant for like a chest tube. If someone had a pneumothorax, we would have to somehow insert a chest tube in the intercostal space, and therefore we're going to learn that running in an intercostal space, there are going to be a series of muscles in one direction called the external intercostals. Another set of muscles running deep to that called the internal intercostals. And then running inside of the space between it is going to be a VAN. And remember, that's going to be intercostal vein, an intercostal artery, and an intercostal nerve. And then if you flip those ribs on the inside, in effect, what you're really eating is the parietal pleura. Remember, the pleura is the sac that lines your thorax. So kind of think of it, when you eat ribs, what are you eating? You're eating the internal intercostal muscles, the external intercostal muscles, the intercostal vein, the intercostal artery, the intercostal nerve. That's what gets stuck in your teeth. When you flip it over, the hot sauce or whatever sauce is gets kind of attached to the mucous membrane. That's the one that you kind of want to suck off all that sauce because it's so tasty, because it's the sauce blending with the mucus, and therefore you're also eating the parietal pleura. So that makes you excited about wanting to jump out of here now and have a slab of ribs. 56, we're talking now about vertebrae. So if we draw a vertebra here, a very generic looking vertebra, we know this is anterior, and this is posterior. And therefore, number 56 says dorsal facing. Posterior is also dorsal, so that's a spinous process. So that's number 56. 57 says the lateral facing process. That's here. So that's 57. That's going to be called the transverse process. Both of those are going to be used for muscle attachment. So you always want to think of, again, the significance of knowing that. I got another way to look at these because I think it's significant to kind of think how they're going to be. If I was to look at an anterior picture of your vertebral column, again, we're going to be seeing something that kind of looks like this from the anterior side. The muscles then that are going to be on these transverse, so this is a TP. These muscles that run between the transverse processes, we're going to learn, are going to be called the intertransversarii. So that's why we want to know why we want to know something. Otherwise, again, it's insignificant. The same thing, if we looked at a lateral view of your vertebral column, we'd see something that kind of looks like this. Here's your transverse processes coming off the sides. So that's a TP here. But this is a spinous process. And of course, the spinous process is going to have muscles running between the spinous processes. Since these ran between the transverse processes, they're called the intertransversarii. Since these run between the spinous processes, these muscles will be called the interspinalis. So therefore, again, the reason is you want to know why I want to know something. So that takes us to number 58. Since we already talked about ducted glands, this question says ductless glands, and a ductless gland is going to be an endocrine gland. If it's ductless, that means it sends its secretion, and the secretions are going to be hormones, and hormones are going to be chemical messengers. And of course, chemical messengers are going to send the hormone into the bloodstream. And then there will go that to the target organ. So just think endocrine is going to be ductless, exocrine is ducted, and when we talk about endocrinology, we'll learn about the pancreas, which is going to be both an endocrine and an exocrine gland. 59 says chemical messengers. We always answered that. That's a definition of a hormone. 60 says joint of the inferior appendicular to the axial. Well, if you kind of think of the axial skeleton is going to be your vertebral column, and where the vertebral column joins up with my pelvis, the two have got to go together. And so therefore the joint of my inferior appendicular to my axial skeleton is going to be the sacroiliac joint. Remember the sacrum, well, the sacrum is going to be part of the vertebrae, so that's going to be axial skeleton. Iliac is the ilium, so that's going to be appendicular skeleton. That's an appendage. And therefore, that's where the two join together. Again, that's another place of lower back pain. 61 says the joint of the superior appendicular to the axial. Now I'm going to go to my upper extremity. I'm going to be attaching my sternum to my clavicle. So therefore, that's going to be called the sternal clavicular joint. Remember, the sternum is going to be part of the axial skeleton. The clavicle is going to be part of the appendicular skeleton, and therefore that's why it's where the superior axial skeleton articulates with the appendicular skeleton. I think something that's very significant there is that's a very weak joint, and so therefore when you kind of think you're holding your body up, it certainly could not rely on that very weak joint between my clavicle and my sternum. So therefore it's all the musculature of the arm and the upper extremity that actually is holding my body up. 62 says the two names for the bone functional unit. That's either going to be called the osteon, which is also called the Haversian system. 63 says the outer skin cells. Remember, outer skin, we talked about of the epidermis. Remember, that's where we're going to have our layers of the epidermis: stratum corneum, stratum lucidium, stratum granulosum, stratum spinosum, and then finally stratum basal. And I told you, remember, stratum basal is where I'm going to have my basal cells, or I'm going to have my basal cell carcinoma, which is the most common type of cancer. 64 says the germ layer of bone. Again, we talked about germ layers. We know that bone, cartilage, muscle, those are all going to be mesodermal germ layers. 65 says the germ layer of cartilage. Again, remember, cartilage and bone come from the same derivative, so that's also mesodermal germ origin. 66, bones in the acetabulum. Remember the acetabulum? We know the acetabulum because that's where I'm going to join my bones together, forming my hip socket. And remember, this is the ilium on the top. We've said this several times, and that's my ischium, which is posterior, and my pubis anterior. And as those three come together, I form the acetabulum. So the bones of the acetabulum are the ilium, the ischium, and the pubis. Again, explain the answer. If I broke my femur, my hip socket, I literally have broken 4 bones. 67, the proximal lateral femoral process. If I was to take a look at a femur, I know that the femur would be sitting, we'll put it like this so it looks very anatomically correct. So kind of think this is the head of my femur, and over here is going to be where I'm going to have my greater trochanter, and this is going to be my lesser trochanter. And the question here says, what's the proximal femoral lateral process? Proximal is towards the top, lateral is towards the side, femoral is on the femur, and therefore this large bony attachment here for muscle is going to be called the greater trochanter. Just think of that as a place where my muscles are going to be used for attachment. 68 says the proximal medial femoral process. Well, proximal again towards the top, femoral of the femur, medial towards the midline. Sure enough, this is the lesser trochanter. So again, those are my muscle attachment points. It's kind of significant to think of those is because even though you really don't see it, if I was, for example, walked into something and broke my top of my femur, there's a natural fracture line running between my trochanters, or my penis, called the intertrochanteric line, or the fracture line. And that's why oftentimes when someone breaks their hip, they not only break their acetabulum, or the cup that the head sits into, but they also have to literally cut off the head of the femur and that's where they put a implant in or a prosthetic hip. Number 69 says the structures above and below the centrum. Well, remember, if I was to look at a vertebra, so I'll try and make this simple for you here. Here is a diagram, really, of my vertebral column looking laterally. And I know that I've got a disc here and a disc here and a disc here. So when the question says the structure above and below the centrum, well, that's going to be an IVD, an intervertebral disc. So that's going to be the cushion that's going to be between the centrum or body of a vertebra. Again, when you look at there's always different names for structures, but if I was to draw what I would call a very generic looking vertebra right here, remember that's the spinous process, that's the transverse process, this is the body of the vertebra. The body is also called the centrum, and it's above that centrum is where I have my IVD or intervertebral disc. 70 says within. Within is going to be the word intra. So within something. Okay, so within is intra, and I don't know if we have it here, but you also remember if there's something within, you can also say something is between. So intra equals within, and inter is going to mean between. So between two things is inter. Intra is within something. 71, what closes my nasopharynx when I swallow? You know, when I swallow, I have to keep air from basically, or fluid from coming out of my nose. So therefore, if you open up your mouth, you notice that you'll say ah, and when you say ah, you notice there's a little structure hanging down called the uvula. So the uvula is a structure that basically is going to close my nasopharynx when I swallow. You know, if you had someone that snored quite a bit, they put on CPAP machines. A lot of times people, when they drink carbonated beverages or they drink beer, and if your uvula was removed, because they do laser uvulectomies, literally the carbonated beverage or the beer literally blows out of your nose. So you have to literally concentrate as you swallow. Number 72 says, what are the sacs that contain the lungs? Do you remember when I talked about costa and the intervertebral, the space between the costa and intercostal space? And so if I was to look at my ribs itself that are surrounding this, so kind of think the ribs are kind of coming across here in this direction. These are ribs. So therefore, this is the lung, so that's called the visceral pleura. Visceral pleura is going to cover the lung, but the lining of the cavity is going to be the parietal pleura. So 72 says the sacs containing the lungs are the pleural sacs. But remember, those pleural sacs are to be comprised of the parietal pleura. Same thing when I gave you the example of when you eat ribs, what you're actually eating. 73 says the common locations for circumduction. Remember, the word circumduction is defined as to flex and extend and adduct and abduct. So all four of those actions together. So remember, flexion, that's going to be to decrease an angle. Extension, increase an angle. Adduction is towards the body. Abduction is away from the body. And the three places that it says that can be used, number 73, and the common places, well, the common places are going to be shoulder. Remember, the shoulder is going to be the glenohumeral joint. It's going to be the hip. And finally, it's going to be the thumb. So those are the places that classically we circumduct. Always think of this circumduction as being sometimes called the pitcher's movement. Okay, it's going to be this kind of rotation in a circle, making a circular motion with the shoulder. Number 74 says a fully movable joint. That's diarthrotic. That's probably the most common type of joint in the body. When I look at my fingers, I know that all of those fingers have got phalangeal, interphalangeal joints. So just think of all the joints I've just got on one hand. These are all fully movable joints, or diarthrotic. 75 says a fully movable, slightly movable joint. That's the word amphiarthrotic. I already gave you an example of the pubic symphysis for that. And there's also a lot of amphiarthrotic in the vertebral column. Actually, most of them are amphiarthrotic. 76 says the smallest bone, that's the stapes. 77, immovable joint is synarthrotic. Remember, synarthrotic, the best example of that is going to be a suture. So those sutures that I talked about on the calvaria, the frontal or coronal, the sagittal, the squamosal, the lambdoidal, those are the immovable joints. 78 is the autoimmune. Remember, autoimmune is the definition of self, recognizes self as non-self. So therefore, when I think of those diseases, I think of autoimmune diseases like Crohn's disease. I think of multiple sclerosis. I think of lupus. I think of RA, or rheumatoid arthritis. A lot of autoimmune disorders out there. A lot of medications. You'll constantly see that people are taking. Why are they taking those medications? To suppress their immune system. Because their immune system is so strong that it literally attacks their own tissue. 79 says a specialized joint in the alveolus. Well, an alveolus is a tooth socket, and there's a specialized joint in the tooth socket called a gomphosis. It actually is using the periodontal ligament to attach the root of the tooth into the alveolus or tooth socket. Number 80 says rheumatoid arthritis. Remember, rheumatoid arthritis is an autoimmune arthritis. Generally a female disease. It's one that you're going to see Bouchard's nodes oftentimes. These kind of bumps alongside of the phalangeal, interphalangeal joints. Again, the only way to treat it would be to some type of immunosuppressant. 81, synovitis is inflammation. Remember, itis is inflammation. Inflammation of the synovial joint, or the synovial sac. So if I've got a bone that comes down, and I'll just say we're inside of my fingers, and then there's another bone here. So these are my phalanges, and I've got some tendons that are going to run around that joint, and then on the inside of there I'm going to have a synovial membrane. So it's that synovial membrane that's going to secrete synovial fluid. And when I get an inflammation of it, that's going to be that severe pain and the inability to actually flex and extend my fingers. Number 82 says the bones comprised in the nasal septum. Well, if you say draw my nose, the nose is fairly simple. Since these are my external nares, my nasal septum divides my nose in two pieces. I know the inferior portions formed by the maxilla. Remember, the maxilla is actually two fused. I know that the middle portion is going to be the vomer, and the upper portion is going to be the ethmoid. So if someone asks you what bones are going to make the nasal septum, it's literally four bones. It's a two fused maxilla, it's the vomer in the middle, and the ethmoid that's superior. 83 says carpal tunnel syndrome. Remember, the carpal tunnel syndrome is from repetitive motion of the wrist, and it's always going to be caused by compression of the median nerve. 84 says what melanocytes do. Remember, melanin is black pigment, so it produces melanin, which gives the color to my skin, gives the color to my eyes. So when you think of an albino has an absence of melanin, so albinism therefore doesn't have dark or black pigment, and that's why they oftentimes, number one, can't see in direct sunlight, have to wear real strong 2-3 pair of sunglasses, literally. But they also have a high incidence of skin cancers. 85 says black pigment. We just said that's melanin. Again, that's referring back to melanocytes. 86 says absence of melanin, and therefore that's albinism. 87 it says significance of the intervertebral foramen, and that is really for exit of the spinal nerves. So again, to make this fairly simple, if you had from an anterior perspective, if this is a view of your vertebrae anteriorly, and this is going to be a transverse process, and this is going to be an IVD and an intervertebral disc. The space that actually comes right across here, this indentation, is going to be where my spinal nerves are going to exit. So that's why oftentimes, the class example is someone goes home and says, help me move a piano. And when they do that, what they do is cause a movement of that intervertebral disc and cause either a spondyloliosis or spondylolisthesis. And therefore, as a result of that, you get compression of either the motor or sensory root coming out of that spinal nerve that's exiting. And to make this very, very simple, if you just kind of think that the spinal cord is running inside of that foramen inside of the vertebrae, and if you looked at the spinal cord, you'd see it's got something that looks like this, and coming off of there are going to be roots. And you're going to have a motor root and a sensory root. And where the two come together is going to be a spinal nerve. So that's why when I say the significance of the intervertebral foramen is that's where I'm going to have the motor and sensory roots coming together, forming my 31 pair of mixed spinal nerves.